Welcome! Today, we are diving into one of the biggest, most critical challenges in modern medicine. We're talking about connecting this huge, fragmented world of healthcare data. We're going to explore why making electronic health records, the digital charts for patients, talk to each other is the absolute key to a safer and way more efficient future. So let's jump right in and look at the core of the problem.
It's a really weird question to ask in this day and age, isn't it? I mean, we can move money all over the world in a blink, but getting a simple lab result from one doctor's office to another, sometimes that still depends on a fax machine. It's wild. And that disconnect is exactly what we're talking about today. And look, this is way more than just an inconvenience. It's a serious problem. When your data is locked away in different silos, one piece at your primary doctor's office, another at a specialist's, a third on a hospital server, it creates all these gaps in your medical history. And those gaps can lead to real clinical risks, major delays, and honestly, just worse outcomes for patients. Okay, so to fix all this, we first have to really get our heads around the solution. And that solution has a name: interoperability. It's a word that gets thrown around a lot, but what does it actually mean when we're talking about healthcare? Let's break it down. The really important thing to notice here are those three key actions: exchange, interpret, and use. It's just not enough for one system to shoot data over to another. For this to actually work, the system on the other end has to be able to understand that data and then use it in a meaningful way to take care of a patient. And this is actually broken down into three different levels, which makes it a lot easier to understand. Foundational is the most basic level. It's just the pipe, the connection that lets data move from A to B. Then you have structural, which makes sure the data is organized in a way both systems can read. Think of it like a shared file format. But the top level, semantic, that's where the magic really happens. This is when both systems share a common language, so they truly understand the meaning of the data. And the stakes for getting this right are just massive. The price we pay for our current, disconnected system isn't just about frustration. We can actually measure it in real-world clinical risks and a staggering amount of wasted money. This data right here is incredibly revealing. You can see that while almost all hospitals in the US have the certified technology, only about half of them can actually do the 4 essential things for interoperability. And this just hammers home a critical point. Just having the tech doesn't mean you have a connected system that works. And the economic hit? It's enormous. Some models estimate that if the US healthcare system were fully interoperable, it could save up to $81 billion every single year. A huge chunk of that comes from cutting out waste, like the 1 in 5 medical tests that get reordered just because a doctor couldn't get their hands on the previous results. But beyond the money, the risks to patients are very real. When a doctor doesn't have the full picture, it can lead to all sorts of problems, from ordering a test that was just done last week to a total breakdown in communication when a patient is moving from the hospital back home. Each of these is a potential disaster waiting to happen. So how do we actually fix this? Well, the answer is in building a really solid technical foundation, one that's based on shared standards and modern tech. This is basically the blueprint for a healthcare system that's truly connected. This table here shows some of the key players that make this all happen. You've got things like HL7, which is like a universal grammar for health data. Then you have FHIR APIs. Think of those as the modern, super flexible digital highways that let apps and systems talk to each other. Direct messaging provides a secure way to send info from one provider to another. And health information exchanges, or HIEs, they act like regional data hubs connecting different organizations. And the difference between the old way and the new way is just night and day. On one side, you have these slow, clumsy, error-prone processes like faxing and manually typing in data. On the other, you've got workflows that are instant, automated, and secure. This isn't just an upgrade, it's a complete reinvention of how we deliver healthcare.
Okay, so theory is one thing, but let's make this real. Let's walk through a pretty common patient scenario and see how a fully connected system completely changes the experience for everyone.
This quote really nails the goal here. At the end of the day, what we want is to create a single, seamless story of a patient's health that their whole care team can see, no matter where they are. So our story starts at a normal checkup. The primary doctor decides a specialist is needed. Now, instead of faxes and phone tag, the referral, along with all the patient's relevant history, is sent instantly and securely. The specialist office has all that info before the patient has even walked out the door of the first clinic. And from there, it just keeps flowing. Lab orders are sent out electronically. Then, and this is so important, the results flow automatically right back into the patient's single unified health record. That means both the specialist and the primary doctor can see them. Prescriptions, they're sent digitally to the pharmacy, which gets rid of all those errors from bad handwriting.
The final result is just a game changer. The patient has a smooth, fast, and much safer experience moving between doctors. The administrative staff isn't stuck on the phone all day chasing down records, and the whole care team is literally on the same page, which leads to better, more coordinated care. It's a win-win-win.
So when you see it all laid out like that, the conclusion is pretty obvious, right? Making interoperability a priority isn't just a tech project. It's a must-do for any healthcare organization that wants to be around in the future.
So let's quickly recap the big takeaways. A connected system means better patient care, period, because providers have the full story. It slashes all that administrative waste through automation. It leads to real, significant cost savings. And maybe most importantly, it builds a flexible foundation that's ready for whatever new technologies come next.
And that really brings us to our final thought. With things like telehealth, remote monitoring, and complex care networks becoming standard, things are only going to get more complicated. Staying disconnected just isn't an option anymore. So the real question we all need to be asking is this: what is the actual price, in patient safety, in efficiency, in people's lives, of failing to connect the dots?